Welcome to Task Talk, real talk, real change. Today, our guest is Barry Zaks from the Huntington Drug and Alcohol Counseling Center, and we're so happy to have him with us today.
Linda, thank you so much for having me. I'm thrilled to speak to you.
So, Barry, let's start. Can you tell me a little about your journey with addiction and what led you to where you are today?
Well, listen, the whole thing started from me finding recovery, and I am as least likely as anyone I've met to find recovery. When I was using, even when I finally landed in a rehab and in treatment and started to do well, still, had you told me that one day I'd be working as a helping professional, let alone running programs, I would have fallen on the floor and laughed at you. I would have told you it's akin to telling me I'd be doing ballet on the moon. It wasn't a vision I had, and what I try to tell people if they find recovery or pursue it is that they don't know where they're going to find themselves. So, I started drinking and smoking pot like many kids at like 13 years old, and it was fun, and I made friends, and I lost my inhibitions, and things that were cute maybe when I was a teenager wasn't so cute by the time I was 30, and by the time I landed in treatment for drug and alcohol use, I was broke and wasn't talking to anybody and completely isolated, not having fun, unemployable. I think my skin and eyes were pretty gray, and basically I was 30 going on about 13 emotionally. So it's been quite a ride, and at about 5 or 6 years in recovery, I went back to school to get a credential for counseling, and I was the most frightened intern at the same hospital where I had been a patient.
Wow.
And I remember going to my counselor at the time, because they say every good counselor has a counselor, so I've always stuck to that. And I said, I don't think this is for me. And my counselor was so gentle. My counselor said, just give it a little chance. And so I just had to walk through some of the anxiety. And I was a natural. I got hired in the middle of my internship. And I have amassed wild stories. And people who sponsored me became patients,
right,
friends with the family and all that. And the important thing is that I've never let it keep me out of working on myself and my own recovery,
which is great.
And that's, I try to practice what I preach. And the field, as you know, people come to it from a lot of different directions. And it's important that we practice what we preach.
You're such a role model and a power of example for people. And you mentioned something about anxiety, and, it's funny when we put the drink down or the substance down, we don't know what to do with these things that come up, which we call feelings, and we don't know how to name them, and it's something we have to do, so it's really challenging in the beginning.
I encourage people to use support and help and guidance when there's stress and problems, but I think when life goes well, I've seen a lot of people relapse.
Right.
They go so far in recovery, and that's when that inadequacy, that anxiety really can pop up. So I think people need support for recovery, not just based on the circumstances around them, but really to help deal with what's inside them.
Right. So in your experience, what are some of the most common misconceptions about substance use disorder?
Well, I want to tell you that whether you call it substance use disorder or addiction or chemical dependency or alcoholism, that we're really dealing with a primary illness with its own set of symptoms. Everybody's different, but addictions, substance use disorder can be very predictable. It's predictable in that it's progressive, and it's predictable in its course of treatment, and recovery is predictable and also progressive. And people lack nuance. Everything is being portrayed sometimes as black and white. I know people who've been through trauma. Trauma can be a great contributor to people developing a propensity for addiction. I know people from all sorts of dysfunctional families and low socioeconomic situations who could take a drink and put it down and forget the drink was on the table. They don't have this.
Right.
So there's plenty of items that can contribute to addiction, but it's in every family of every person I've ever met. Now, maybe there's someone out there, I haven't met them yet, and I won't say this anymore, but it's very democratic. It's not what people think. People read the headlines, or you see someone lying in the gutter or begging for change, and you say that's an addict, that's someone who needs treatment. But behind the closed doors in even the most wealthy neighborhoods, this often lurks. And so I think the biggest misconception is that somehow this is less than democratic.
Right. So addiction is often described as a disease. How do you view it? Is it more than just a matter of willpower?
Well, an interesting question. There are people with alcohol or drug problems who put down the alcohol and drugs, and their problems are gone. But once someone has crossed the line into addiction, a severe substance use disorder, if you will, they put down the alcohol and drugs, their problems are first starting. Now they have a deficit. There's coping skills that haven't been established, or relationships and boundaries and maturity that hasn't been dealt with in many years. So it's not a matter of willpower. And that's another misconception that people have, that if only people had the right job or the right relationship, or they lived in the right neighborhood, or they had the right amount of money, well, then they'd be okay. That it really depends on that outside stuff. Now, we want people to be productive and feel good and find right relationships, but the recovery part has to come first, and not the other way around.
Right.
And I know many people who have spent so much time chasing that outside stuff to sort of fill up that emptiness that's at the heart of addiction.
Right.
And it never works. I've had, when I was working in a hospital, I've had several patients who won the lottery, and it didn't fix them. All the money's gone. So this is really, really powerful stuff. And that's why when life goes well, it's a touchy time. It's a relapse trigger.
Sure. You mentioned trauma earlier. Do you think that trauma or past experience is a significant factor?
A factor, a contributor? Absolutely. I'm not an expert, but I've read about the ACEs study, and I've been in the field and been trained and read all the peer-reviewed journals, of which I understand some, to know that it's a big contributor. But it's also drinking and drugging contribute to mental illness and trauma.
Right.
So it's not just a simplistic one-way street. So they're definitely contributors, and what happens when people put down alcohol and drugs is a lot of this stuff comes up. For some people, alcohol and drugs is sort of the glue that holds people together.
Right.
So their problem isn't drinking and drugging, their problem is living without the drinking and the drugs. And often in families where there is trauma and mental illness, there is alcohol and drugs. So it's a contributor and also an effect.
Right. Well, I often hear that alcoholism and substance misuse is a disease of isolation. It becomes like your best friend, your substance, and we keep people away from us. We keep the substance close to us because that's what's comfortable. That's what we know. What was the turning point for you when recovery started to feel like it was a real possibility?
Somehow the turning point was people. And when I started to meet people who had been in worse situations than I ever were, and they were living a productive, satisfactory life and happy with themselves, I started to want what they had, and I started to feel hopeful. It's corny stuff in AA and 12-step programs. They say, let us love you till you love yourself. It's hokey, and I was very turned off by the corny language at first, but there's really something to it, because I didn't have the vision of my own sobriety, my own recovery, my own ability to stay clean and develop a life, but other people did. So somehow I landed with a professional, a counselor. He told me I should go to 12-step meetings and come to treatment, that together they can really help me get a good foundation. And at some point, my life got bad enough that I made a really good decision that I'll take credit for. I decided to trust him. It was a decision. And people are looking for what's the turning point, what helped you find recovery, like some magical lightning bolt. There's two things that helped me find recovery. I ran out of drugs and I ran out of money.
Well, that'll do it.
Thank God.
Right.
Thank God.
Mhm. That will definitely do it. You know, there's a lot of people from the outside looking in. What were some of the biggest challenges during recovery that people may not always understand?
Well, I think when people start to clear up a little bit and feel better, they want the trust back. They may have betrayed trust in the family for years, and then 2 weeks into recovery, they don't understand why people are still flinching every time they come. So I want people to take the support where it is, and not always where they want it to be, because recovery shows itself, and trust comes back, and relationships come back, but it's really a long, slow process. So I want outsiders to understand that just because somebody goes to a rehab for 28 days, that does not mean that they're anything except an infant in recovery, and that there's a lot of work to do, and that people need their space. I also wish there was more belief in people's ability to recover. Man, I've met people really from again, situations I've never even been in, that you'd think were hopeless, that have wonderful lives. And I think either the family or sometimes helping professionals, they sort of give up.
Right.
And they sort of, it's called therapeutic despair. It's no good. And I think helping professionals need to keep themselves hopeful and well,
Right.
so that they can instill that hope in others.
Well, that leads into a really good question. Addiction is often stigmatized. Okay. And what do you think we as a society can do to break down the stigma and approach the topic with compassion and understanding?
I think it ought to start with us instead of demanding it start with someone else. And in our field, helping professionals, you know, there's some really good stuff that's happened, and there's some really bad stuff. The good stuff is this is in the news a lot more than ever. It's in the movies, it's in TV. I think people have become more comfortable talking about addiction and alcohol and marijuana and mental illness and trauma. I think people are more comfortable than ever. And I think that's great.
Right.
I think that is very helpful, that people may feel less embarrassed because they've been caught up in this.
Right.
It's everywhere. But on the flip side, I think there's still more stigma than people realize, even in the helping profession.
Right.
And to me, being addicted is like having a glass of water. It's a matter of fact. It's not an embarrassing, horrible defect. I thought I was crazy. I thought I was defective. For me to find out that this is an illness that hijacked me and changed me was, as I began to accept it and understand, what a freedom, what a relief.
Right. And you didn't ask for it.
No, I've never met anybody who says, at one point in my life, I decided I would like to become addicted.
Right.
I thought I'd like to visit some detoxes, go to jail, ruin my relationship with my family, avoid my children, owe a lot of people money, hurt my liver, and lose my ability to sleep and cope with any.
Right.
Who's decided that? What a relief it is for people to take responsibility for their own sobriety.
Right. That's great. What resources or type of support do you think are most helpful for people that are struggling?
Well, it's considered old-fashioned or 20th century, but people don't realize the 12-step program, the parent program is AA, but there's also a lot of Narcotics Anonymous meetings on Long Island. Those are the two main fellowships for the family. There's Al-Anon and Theranon. There's because I counted, 1,250 AA meetings alone in Nassau and Suffolk.
Wow.
And now there's Zoom meetings and all that stuff.
Yes. Yes.
So there is a community of people in various phases of recovery who are just waiting for the new person to walk in the door to welcome them.
Right.
Somebody can go to a professional and say, "Oh, I'm addicted," and they may say, "Oh, well, maybe you need some pills, or maybe you need to address all your childhood issues, and then the drinking and drug and all stuff." When people go into a peer support situation, what they get is encouraged and hugged and welcomed.
Right.
And believed in rather than disbelieved. Now,
They feel loved.
addiction counseling is different than traditional therapy in a lot of ways. The biggest way is it seems intuitive. If someone could deal with their issues, they wouldn't drink and drug. But our approach is if we can teach people how to put down the alcohol and drug, not be numb, adjust to that, well, then they could deal with their issues. That might seem like semantics, but it's not. It's really important.
Well, I too am a big proponent of the 12-step programs because I believe that, I drank for a reason, so when I put the drug down, then what?
Right.
It's like, so 12 steps is a perfect program to begin with. A lot of people don't stay with it, but it's a great foundation, and you mentioned Al-Anon and there's different programs, but what about ACOA, which is now ACA, which is a great program for people? There's so many different types of programs like that.
You mentioned isolation, the disease of isolation. So part of the recovery is getting people to feel connected.
Yes.
And I think people misunderstand the term spirituality. They think they have to find a religion. Some people do. But I think getting connected
Right.
is a big part of recovery because by definition, substance use disorder or addiction, at least emotional, isolates people. It removes them from feeling connected.
Right.
And I think that's the real value of that. And then, look, there's professional help, which combines, Lyme people need professional help. It's indispensable. I mean, I'm at Huntington Drug and Alcohol Counseling Center. We're an outpatient provider in the village of Huntington. And people come to us from 12 years old to 87 years old. I'm waiting to break the record on both sides. Every race, religion, ethnicity, demographic, and being in the field and overseeing, helping people really helps me to see the power of this and that it's not just one sort of person who falls into addiction,
Right.
but it's very democratic. So, and it also keeps me working on myself.
Right. It's funny you mentioned spirituality. So I always thought that religion is for people that fear hell and spirituality is for people who lived it.
Well, I like that.
And I think it's important for people to understand, when people first come into the program, they hear God, they hear this. It's not really about that. It's about a God of your understanding, and the spirituality just helps because it's a holistic approach, I think.
Despite my self-thought high IQ, I did very well in school, and all my strength and all my willpower and all my intelligence, my life was a fuming pile of ashes. So my problem, it struck me, is not my lack of intelligence. My problem is lack of power.
Right.
And I think that opens the door to this.
Sure. But just staying with Huntington Drug and Alcohol Counseling Center for a minute, you don't just see people, you have great groups going on.
The idea is that we have highly individualized treatment. Being in Huntington, it's nice that we speak Spanish as well as English. Sometimes maybe our clients might speak English, but their family speaks Spanish.
Right.
So we can get the whole picture. And we try to get the family in when we can.
Right.
Because everyone's been affected by this and impaired by it, whether they use alcohol or drugs or not. But we have individual, group, and family counseling and different strokes for different folks. When we meet people, we don't work on them, work with them and try to find out what's going to be the best way for them to feel comfortable, to feel welcomed, to start to gain trust and rapport, and for us to instill that important value of hope.
Yes.
It's important for us to look at people and not just see the substance use disorder, but to see the strengths.
Right.
And I think all recovery is letting the strengths come out and minimizing the negatives. That addiction magnifies, So someone who is rageful and very angry, it might be good recovery for them to sit back and take a break and not have to respond. For someone who's all shut down and never says no to anybody, it might even be healthy for them to express anger and say no. People are all different. Everybody's different. But everybody seems extremely something when addiction's involved.
Right.
So we want to get people into the middle ground.
What advice would you give to someone who's currently struggling with addiction and they feel like they're at rock bottom?
I would say welcome. and that's really important. People don't really want to be lectured at, and they don't want to be competed with. Like, to sponsor someone in a self-help group is to share your own strength experience at
Right.
home. But to be a counselor or a social worker or a helping professional involves a set of skills and tools. It's very different, you know. So the most important thing anybody can do from any area of trying to help is to make them feel welcome.
Right.
Uh, and
not judged.
and not degraded. And if there's been trauma, not re-traumatized. And the system, and there's a lot to the system, can be re-traumatizing. People are used to authority figures that they have problems with, and whether we want to be or not, if people come to my agency, we're authority figures. So the first thing we want to do is make people feel welcome.
Right. And I know you guys do a great job at doing that.
Well, thanks. Thanks. I believe in what I do. I think Huntington Drug and Alcohol Counseling Center is one of the last vestiges of an old-fashioned counseling center. It's by design, not particularly bureaucratic or corporate. It's not sterile. We're all very professional there, but we don't let the wall of professionalism be a conflict for clients who need to develop some connections.
Right.
And we're very well regarded for caring treatments, and I'm proud of that.
Yes. How do you see the future of addiction treatment evolving, especially in terms of accessibility?
Well, there's been a lot of good work done with people that I know, fighting the insurance companies and going to Albany, and a lot of legislative progress. And there's some elected officials in Huntington and in Long Island who've been really allies with the
community. Very supportive.
So that's really helpful. At the same time, you know, there's budget cuts, political turmoil, uncertainty. I mentioned Zoom meetings like the 12. It's wonderful to have the technology to be able, maybe at 3 a.m, to get on and get a support system. The flip side of that is we're trying to help people develop connection.
Right.
And as life in general becomes more fragmented, and people with their phones hide behind the screens, in some ways it's harder sometimes to get people to develop those connections.
Yes.
So again, there's the yin and yang. There's the good part and the bad part. I am concerned. We need to be more scientific. Medications have helped a lot of people get off the street and can be a lifesaver. But they're tools to an end. As we get more scientific, which is overdue, we shouldn't lose that spiritual part that you were talking about, the spirituality. There is no medication that helps people gain maturity, spirituality or boundaries. And since recovery is long and slow, there's no shortcuts.
Right.
And I understand everybody wants a shortcut. Linda, I wish I could be really thin and eat whatever I want. I really do. I wish that. But my reality is it's not available to me.
Right.
And we help people with the substance use disorder with the reality, what is and not available to them. It's the obsession of every addicted person I've ever met, that there's got to be a way they can control the drinking, the drugging, or their life when they drink and drug.
Right.
Some of them have spent their lifetimes trying to control the drinking. It's so hard for them to throw their hands up and say, I surrender. And yet that opens the door.
Acceptance is really challenging. It's hard to accept anything, you know.
One of my best friends who passed away years ago from cancer, I'm in touch with his son who's struggling in and out of treatment, and I'm very concerned for him. I told him, because I met with him, he came to New York, he lives in Nashville. I said, you know, your problem, and I know him enough that I could talk to him in an informal way. I said, your problem isn't drugs. Your problem is arrogance. He said, yeah, I know. It's hard to get humble. And I think part of what people don't understand is that for people who have this, alcohol and drugs sort of magnify that stubborn arrogance that we're all capable of. And people take it personally. This is not personal. The spouse thinks if they loved me more, they wouldn't drink or use drugs. Well, that's what they think, right? It's not personal. And the best we can convey that, the better the chance it'll work.
It's a me program, right?
Yeah.
You have to work for yourself.
I was told years ago, this is a selfish program. I said, I can do that.
Yep. If there's one message that you would like to share with someone who's listening right now or maybe struggling, what would that be?
Well, I guess that I believe with all my heart and soul that recovery is possible. I really do. And I wish people would use my belief in them before they believed in themselves.
Right.
I think that's how it works. And I think we need to get to that point together where we can convey that belief in people.
Great. Barry, thank you so much for coming in and sharing your insights with us. It's really great to have you. This is really important because recovery is possible, and you said that earlier. And Barry, if somebody wants to reach you, how would they get to you?
Well, first, thanks for having me. And Huntington Drug and Alcohol Counseling Center is at 631-271-3591. We speak English. We speak Spanish. We take most insurance. We turn no one away if they're not insured. And we're open morning until evening. We have no waiting list, and we're there to help. And I encourage people to call. No question is too small.
And if you know someone who's struggling, please tell them to reach out to us. We want you to know that you're not alone and that we are here to help. We have a lot of resources, and it's so important for you to stay connected. Thank you.